Hi, good morning, and welcome to CEID's first event of fall of 2025. I'm Nahid Badawi. I'm an infectious diseases physician. I'm an associate professor at the BU School of Medicine and the director of Center on Emerging Infectious Diseases. Before I turn the podium over to Tracy to then have our esteemed guest come up, let me just frame the fact that we're living in a moment where values and data are fighting for each other in an imagined way, and they're playing on a field where messaging platforms and also access to care are all competing. And particularly around vaccines, no other moment in time has been as frightening to those of us in public health than in the last few weeks, as we've seen both at federal and at state levels, changes to policy that could potentially restrict both access to vaccines, but also decrease confidence in vaccines. So I cannot think of a better speaker than Dr. Viswanath today as he helps us navigate some of these issues. CEID generally has two semi-annual events and then has additional core events. The center is organized in 4 cores, and today's event is part of the Trust in Public Health Communications core led by Dr. Tracy Hong, who's a professor in media science and whose research focuses most importantly on the intersection between health communications and media. So we cannot, again, think of a better moderator for an event. So with that, I welcome Dr. Hong. Thank you.
Thank you, Nahid, and welcome everyone. It is my great pleasure and honor to introduce Dr. Vish Viswanath, one of the world's leading scholars in health communication. Dr. Viswanath is the Lee Kum Kee Professor of Health Communication at Harvard T.H. Chan School of Public Health, and he's also at the Dana-Farber Center Institute McGraw-Patterson Center for Population Science. It's a lot of words there. He also serves as a faculty director of the Health Communication Core and associate director for community outreach and engagement at the Dana-Farber Harvard Cancer Center. In addition, he directs the Harvard Chan India Research Center and the Lee Kum Shung Center for Health and Happiness, and is the founding director of the ECHO Lab, which stands for Enhancing Communication for Health Outcomes. He's a busy person in demand, and we are very, very fortunate to have him spend this hour talking to us about this very important topic. Dr. Viswanath is a groundbreaking researcher, and his work centers on how translational communication science can advance social change, which is more important than ever in today's age. He has published more than 330 journal articles and book chapters and co-edited 5 major volumes, including the 2024 Understanding and Addressing Misinformation About Science, published by the National Academies. He has served on national committees for HHS, CDC, and the National Academies. His leadership has been recognized with numerous national awards, and in 2024, he was elected as the Fellow of the American Association for the Advancement of Science. A great person for us to have to talk to us about this important topic today. He will be speaking to us on countering misinformation and building public trust in science. Please join me in welcoming the esteemed Dr. Vish Viswanath.
Morning. Good morning. Right. It's a little early in the morning, right? 11 o'clock, number one, thank you for having me. That was a very generous, more than generous introduction. That's a lot of huge buildup. Hopefully I won't disappoint you, it's such an honor to be here. I've been watching the center, and as I said, it's just not the research that's going on here, but how seriously you take public education and public communication at a very critical time, as Dr. Badelia averred. It couldn't be a better platform for me to offer you my pebbles of wisdom, so to speak, and see, I look at this more like a conversation, a dialogue with all of you and those who are on the Zoom, rather than giving a talk where I only have 500 slides. So I think it's much better if we engage in that conversation. So you may see me skipping some slides, but don't. I think my points are very brief and hopefully they will be clear, I think, as we go through these slides. So again, with that, just wanted to acknowledge my disclosures, so that, especially these days, apparently we all have conflicts of interest, maybe not everyone's following that the story there, but that's supposed to be facetious in some ways. We have been seeing this, sorry, I have to stand here. I usually walk around the room, so misinformation as an idea, as a phenomenon, is nothing new. So in fact, one might argue communication, or particularly news journalism and communication in this country, started off with a lot of misinformation. Offering the criers and the flyers, which were precursors to the newspapers, offering shipping news. Arrival and departure of ships, also offered a lot of snake oil advertisements in the famous snake, so as a panacea for all kinds of treatments, and so we always had these charlatans and pseudo experts. If you think we only have them today, historically we have always had them. And the question then comes up, why are we talking about it much more so today than at any other time? So I'm going to make three broad stories or themes, so to speak, and in order to make the points I want to make. First, I want to lay the ground for what we mean by misinformation, and then as a part of that, effects of misinformation and the patterns, social patterns, including inequalities. And second, and I also will talk about the sources of misinformation and information, and end with some ideas about how we can counter it. And certainly, I think the center is already doing that. And we all need centers like this to help us at a very critical juncture in our country's history. So, the first act of the story is information is not communication. We live in a hyper media, hyper information environment. Of course, in a room like this, you all think of only social media, but there are communication platforms and channels beyond social media. Actually, what we call in our committee as information ecosystem. The information ecosystem is pretty complex, with multiple channels, multiple sources, conversing and talking with each other, as well as talking at each other. And so all that will not lead to very salutary impact. So we always talk about information. You cannot talk about misinformation without talking about information, right? So because no one's going to get up in the morning and say, I will now get exposed to misinformation, right? What they're doing is, I want some information on X, Y, or Z, and in the process get exposed to misinformation, right? So I want to tell this story. I think Dr. Badilia started addressing this. So I want to for this audience, maybe this is all familiar. So, but I wanted to start the story because it is so stark. And so I'm going to do it through vaccination, right? So in this room, I don't have to tell you why vaccination is important or immunization is important in many ways, and particularly childhood immunization, where we have amazing, incontrovertible data, right? Even though there are people who say these data are uncertain, but the fact of the matter is we have fairly good history developing science and very settled science, actually, when it comes to vaccination, where we have been able to save millions and millions of lives, and will continue to do so as long as we vaccinate. And the interesting point about this is, if you think about it, I wanted to show this to you because sometimes we forget history, right? So if you look at the left-hand side of the panel, that is, these are 3 infectious diseases before the vaccination, administration, or invention of vaccination, right? And administration of vaccination. And then after that vertical line to the right is the prevalence of those diseases. Think about it. And this is, the top one is on smallpox in London. The middle one is on polio cases in the US. And the third one are measles cases in the US. So you can see, anybody who looks at these data, what kind of conclusion or inference should they draw about vaccines, right? This is a history we don't often talk about, right? Or see as it is, right? And it's just not in 3 advanced industrial countries and their cities. You look at the world over, right? Whether it is Europe or Eastern Mediterranean, Americas, Africa, Southeast Asia, Western Pacific, in every part of the world, the introduction of vaccination has saved cumulatively millions of lives, right? So the question then is, what is it that is happening, that we are so worried about, given these kinds of data as foundational to vaccination, right? This is the problem. I thought a lot about, actually, should I even have this slide and the photograph? Then I decided, what the heck, if I am in trouble, I think you are in trouble. So, seriously speaking, and there is it's intentional, the Secretary of Health and Human Services in a department I worked in at one time, so has been offering a variety of hypotheses. It's a glorified term, hypotheses. I could say something else, but I won't in polite company, But these are the kind of, during the recent measles crisis that emerged out of Texas, which spread to New Mexico, these are the hypotheses he has been offering, right? Now, and the important point is, it is a Secretary of Health and Human Services. I don't know how many of you realize the gravity of that, the legitimacy, the credibility that position carries, when it comes to opining on such public health problems, right? And the way, I think this has only created more confusion, more debate, and in their view, more controversy, right? And this is interesting, right? I mean, it just makes up hypothesis. It's very, you and I will be a little bit constrained to say, okay, what did should we say this? What did we say last time around? But he makes up these things, this community has that community has this, this is about Mennonite community where it emerged. Actually, there's nothing in the religion that prescribes vaccination, right? But people make up this stuff, invoking religious authority or whatever they invoke, right? And of course, we heard about vaccines and autism. And I mean, that's the most notorious hypothesis in many ways. And the question is, okay, what is a relationship? What are the data saying on vaccination and autism? So here is a Cochrane analysis that has been reinterpreted around impact of measles vaccines on variety of health outcomes. To the right, you get a lower risk of a particular disease. To the left, higher risk of certain risk factors or side effects. Where is autism? You can't even find it. It is all the way to the bottom here. And absolutely no relationship. Absolutely no relationship. Again, you all know this. So, I think maybe I'm telling this story for myself than anyone else, just to remind ourselves, right? So there is no relationship. And tomorrow or day after, one of these days, some reports will be coming out with all kinds of speculation on autism and other and the sources and the causes for it. But this is one way of inoculation and also trying to say what's the relationship. So now, having said that, what is misinformation, right? So this is the, Dr. Hong mentioned this. So we had a consensus committee on understanding and addressing misinformation in science by the national academies. And we have worked for about, almost took away 2 to 3 years of my life, for the last, starting in 2022, 2023. And finally, we released the report in 2024, December, after the elections. That's a story by itself. I was wondering whether we'll ever manage to release the report or not. I was, after working 2.5 years on it with the committee, chairing the committee, I felt responsible that we had to release a report, and there were some concerns, whether we would ever be able to release a report, and would I have to do something else to get it released? So fortunately, the report was released, and there we, the consensus definition of misinformation then is it's information that asserts or implies claims that are inconsistent with the weight of accepted scientific evidence at the time, right? Which claims are determined to be misinformation about science can evolve over time as new evidence accumulates and scientific knowledge regarding those claims advances. So we spent a lot of time. You can imagine, with 15 people on the committee, there are 25 different definitions, right? So we start with, and I think, the bottom line is here. So there is something called, I want to introduce a concept here, right? Settled science and evolving science, right? So a settled science is a lot of consensus behind it. It's not immutable, but a lot of consensus behind it, right? Lead in paints, right? Is one example, where, our vaccination, which I just gave you, is fairly settled science. On the other hand, when COVID came along, that's an evolving science. We are still trying to figure it out, as if you recall, the definitions of and the causes and the conditions of COVID changed over time as we made more and more discoveries, right? So we do concede, we did concede that what is considered misinformation at one time could be, become information over time, and what could be information could be considered misinformation over time, right? So, and then we felt disinformation about science is circulated by agents that are aware that science information they are circulating is false. In terms of impact, it doesn't really matter whether it's misinformation or disinformation. The impact is out there for both of them, right? So the question then comes up, who is producing science and health information, right? So this is the issue, right? So we are producers of science information, right? So our labs do that, right? And this is what we do. But in terms of interpretation and communication, there's a whole host of actors out there, right, who are actually interpreting and communicating that, right? So one example I'm giving you is activist and interest groups, right? And if you think about it, they're all in the business of interpretation of science, right? That's what they do. But the question is it misinterpretation or interpretation of science, right? So in the world of whether it is vaccines or GMO or whatever it is, you see it all the time, right? And it's global. It's just not in one place. It's also global, where people interpret science. The one to the right are two panels that are very interesting. I don't know why I'm calling them interesting. maybe the bottom one. The top one is obviously many of you recognize, some of you maybe Jenny McCarthy, who has become a vocal anti-vaccine activist. Apparently, she has more credibility than I have and reach, so you see her all the time talking about it. But the bottom one is a more interesting one, right? It is by an organization called the National Vaccine Information Center. How lovely is that name? National Vaccine Information Center. Go take a look at it, okay? All right, it's amazing how they interpret the same science we all see in a completely anti-vaccine way, right? And so if you don't know, I mean, the name sounds so legitimate, right? National Vaccine Information Center, right? But if you don't know that their motivations and their agenda are much more likely to think, oh, this is very legitimate information, right? Now, of course, there's a whole group of people. They were all, it's very interesting, they were outside criticizing. When I presented, I chaired a committee for the National Vaccine Policy Organization for the DHHS. It was called NVAC, National Vaccine Advisory Committee. And I chaired a committee on vaccine confidence some years ago. And I looked at the data. I was even smug. I looked at the data. It's about 78 to 93% of the parents were doing all the right thing, right? They were all getting their children vaccinated, and it's almost 90%. And I said, wow, I mean, the rest of the people who are opposing vaccination are about 7% at the time. I was so confident, so smug. We termed them, it's a fringe group. And there were a couple of anti-vaccine folks in the meeting who just took me to task for saying that, but that's what it was, 7%, 90% of the parents are doing the right thing. But today, my smugness was misplaced. My confidence is misplaced, given now they are in power compared to what it was 10 years ago, 12 years ago, right? So misinformation is not some person sitting in the basement in their pajamas posting messages, right? It could be any of us, right? And this is a whole list in the report. The report can be downloaded free of cost, but it could be anybody who can post misinformation, whether knowingly, which is disinformation, or unknowingly, right? In fact, our own press releases, right? When I publish a paper, my media relations office can say, hey, this is great. Can we write a news release? My ego needs a boost, so fine, except when they have to write a news release, they will take out all the caveats that are necessary, and make it sound like this is the greatest science in sliced bread or whatever it is, right? So, but the fact of the matter is, it could be very misleading. One study, one paper in one journal somehow providing that information. So a lot of for-profit corporations, even government could indulge that, right? But not all misinformation is equal, right? It is most influential when it originates from authoritative sources, right? That's important to know today, right? Authority, right? Authority is legitimized power, right? As sociologists would say, right? And when it is amplified by powerful actors and reaches large audiences, those criteria are now met, when you look at what is being talked about in the name of science from the federal government, right? So what are the effects then? What are the effects? The effects are multiple fold. I'll just introduce. So this was the effect of the measles vaccine crisis and all the misinformation around it. People were using all kinds of drugs, whether they were appropriate or not, to treat themselves at the time. And in fact, some hospitals in Texas reported cases of pediatric patients being admitted with measles and vitamin toxicity. Think about it, right? So this is not without its impact, right? This is not without its impact. But lest you think that I'm giving you only anecdotes, there are some good data now, right? We are now looking at the data. There's most adults do not expect to get a COVID-19 shot this fall. If you have been following the news, the mess we are making on COVID-19 vaccination coming out of the federal government and the confusion, no wonder people don't want to get vaccinated, right? In fact, it just so happens these statements, misstatements, have made it very difficult for people to even access vaccination, right? So organizations such as CVS are claiming that they would not administer vaccination because ACIP and others, federal government CDC has not recommended it until they are being shamed by our governor and other similar actors out there. So there is that impact. In fact, when we looked at it, it's not about misinformation. People become, we didn't want to use the term susceptibility. Intentionally, we use the term receptivity because people don't know. People are exposed to misinformation because of information voids. If they don't find the information, then they're, the right information, they will go for whatever information is available out there. And there are a number of factors that influence it. One of them is this notion of, in addition to trusted source, there are some issues like social determinants of health that matter. For example, so let me clarify on the individual level, right? The misinformation impact is on individual level. We looked at the data. It first influences beliefs, leading to misbeliefs, right, at the individual level. And most of the evidence is at the individual level, right? There's a huge gap on what impact it has on the community level. But community level, we have seen especially on marginalized communities, it can have a negative impact. We have attacked Asians because it was called the Chinese virus during COVID as one example of that. And then, of course, at societal level, it can limit very productive debate on legitimate things. We saw that with Hurricane Helene and others, when there was a lot of misinformation, right? And of course, it diminishes trust in federal agencies, our healthy agencies. And we have also shown in our own data, in our own studies, that misinformation discourages people from complying with public health recommendations, whether it is staying at home, keeping a safe physical distance, washing hands, et cetera, right? I mean, these data have been also published by other people. So it can have an impact. It's not a theoretical exercise, right? Here is a good example of where, people are either not taking recommended regimen of vaccination or they are skipping doses, right? In fact, I was teaching in my class on health communication when somebody in the class told me that she actually skipped certain doses for her own child, right? So think about it. I'm sitting in a school of public health teaching, how am I supposed to react, right? So we see this. But there's one point in this slide I want you to note. Not everybody is equally receptive to misinformation, right? So if you look at it, party ID and partisan identity matters quite a bit. And you will see it all the time, this kind of a partisan ID influencing, right? So people who identify themselves with Republican Party are much less likely to say, that they will keep their children up to date on vaccination or skip doses, right? Are more likely to say they will skip doses, right? And then not everybody is affected equally. So our lab for the last 20 years has been working on what we call as communication inequalities. I'll skip. So everybody in this room, I don't need any introduction to social determinants of health, right, which drive health outcomes. I personally don't like the term social determinants because there's nothing deterministic about it. These are social drivers of inequalities. They are very much mutable if we can design the right policies and systems, right? It's not immutable. Nonetheless, there are these drivers: socioeconomic status, geography, race, ethnicity, et cetera, age. And there are very good data on how it influences, say, vaccination as one example, but virtually every other health outcome, right? So we have been working on what we call as communication inequalities. These are differences among social classes in the manipulation and distribution of information at the group level, and in differences in access to and ability to take advantage of information at the individual level. What we mean by that is, if you take tobacco industry spends, for example, $10 billion on their marketing budget. You tell me which state has, all the states combined don't have $10 billion against tobacco, right? You talk about inequalities right there, right? So, and at the individual level too, class, race, ethnicity, all these things matter. And our argument is these multi-level factors, what we call as social determinants or social drivers, influence 4 dimensions of communication: engagement, access, processing, ability to act, influencing the outcomes. So if we can intervene here, we argue that this is more readily addressable than social determinants, and we can influence health outcomes, right? And we have, I'm going to show you a slide with examples here, but I assure you I have data. I know we have 20 years of data on a variety of health outcomes, including communication inequalities leading to differential mortality among people. But this is a good example of how things we take for granted, like broadband as one example, are unequally accessible, right? So these are serious inequalities which can influence, and this is global, right? Sometimes, in fact, access to information services is gendered. These are focus groups we have done in India, where women told us, that they have heard of these things called YouTube, but the cell phones are controlled or by their husbands, and they have to ask their husband for help, right? I mean, think about this. And then we have been writing in the last about 5 years or 6 years about a phenomenon called data absenteeism. Essentially, what we mean by that is absence of data from groups experiencing social vulnerability, whether it's due to class, race, ethnicity, or geography. So what it does is it leads to incomplete information out there, and distorts the way we draw inferences, right? So you can see that, in clinical trials, as it's fairly well established in the world of clinical trials, but also in science communication, there is this data absenteeism. And what so now we are seeing that AI, right? These practice data sets, how representative are they in terms of whose data are being included, in these algorithms that are being developed, right? So, and there are a variety of reasons for it. If you dive deeper and address data absenteeism, you'll get a completely different picture, right? So, for example, this is a probability-based sample, without addressing data absenteeism, which talks about health information. And to the right, we intentionally oversampled these 5 groups and looked at the same data or questions in greater depth. And what it reveals is significant, everybody is looking for health information, but significant differences, among groups on the difficulties they are having looking for this information, or the trust they have in this information, right? So that, and we showed this on smoking, on cancer screening, etc., right? So data, so we have to wonder and worry about, are we representing everybody in the data we are collecting? The last segment is about trust in science. So, so what we are seeing increasingly, when we say trust, in our field, we have, it means many different things, whether it's credibility or believability or reliability, perceived expertise or availability, or legitimacy, right? It's not that it doesn't matter, but if the Secretary of Health and Human Services, if CDC is saying something, there is certain legitimacy to that, and that could potentially influence how people perceive it and receive it, right? So this is from yesterday's New York Times, where the secretary is fueling distrust in his own agencies now. right, is trashing CDC. I have worked with CDC. Many of us have worked with CDC, right? These are people who work very hard, very competent group of people, very committed to public service. And here we are in their own secretaries criticizing them day in and day out. And that's, you will see this constant criticism is leading to a decrease in trust and credibility. People still trust their hospitals and doctors. Thank God for that, right? They have tremendous credibility. People still trust science and scientists. Thank God for that, But as you go through this, the people are now increasingly questioning and are being skeptical. And Kaiser Family Foundation has been collecting this data. Some of you are involved with it. And it clearly shows doctors and scientists are still trusted a great deal or a fair amount, whereas people like Robert F. Kennedy Jr. or Mehmet Oz these are people in power. Just think about it, are trusted much less, right? And the trust is socially patterned, by the by. So you will see again, the partisan ID matters a lot when it comes to trust, right? Again, if you identify with the Republican Party, you're less likely to trust institutions and doctors and science compared to if you are identifying with Democratic Party. It's not about the party, it's the leadership trying to define the agenda. I'll be happy to explain what I mean by that, right? So I won't go through all of these. Again, this is a global phenomenon. I included this slide because of what my solution I'm going to offer. Even here in our work in India, people showed, women who were interviewed talked about how it's not the media they trust, it is the community health workers, the so-called Anganwadi workers. They trust a lot more because they interact with them, they rely on them, they perceive them to be more credible, right? So what can we do? Now that I have depressed you enough, right, let me offer just a couple of solutions. One is science of message construction. I won't go through a lot. I think Dr. Hang can give a better lecture than I can on message construction. Essentially, what I'm saying here is how you say something is as important as what you say, right? Whether it is storytelling, whether it is fear appeals, whether it is exemplars, whatever it is, construction of the message is as critical as the facts in the message. So that's one thing to remember. I won't go through a lot of it. Remember fear appeals and tobacco as one example of constructing a message. I won't spend a lot of time on it. It's a whole lecture by itself. But to me, what is relevant is science of engagement and participatory science. What I mean by that is we think it's a systems level problem. Misinformation is a systems problem, not an individual problem. So if you want to address it, it has to be addressed at a multi-level way, at a systems level, not at the individual level. You can make corrections, inoculation, and everything individually, but it won't be as sustainable and as broad an impact as you do it at a systems level, right? So there are 4 points at which you can intervene. Increase the supply of accurate information that will drown misinformation. Make sure information is distributed, accurate information, distribution. Allow people to do the uptake, right? Facilitate uptake of information. And last, reduce demand for misinformation, right? In the interest of time, I won't go through all of them, but we looked at the data on all of these. And the question for us is, how do we increase that supply? As I mentioned earlier, right? People are not waking up in the morning to go and look for misinformation. They are looking for information, right? And so how do you increase the supply and access to accurate information, particularly when you are being drowned by authority sources or people in authority, right? So that's something to think about. And how do we do that? How do we get it circulated, distributed, right? So we have been working with what we call as a community engaged approach. Many of you are familiar with this so-called community-based participatory research and community engagement, where we work, co-define the problem with members of the community or stakeholders, co-develop the solutions and trust them to distribute that solution in their community or implement it, right? So, and so we have done a couple of examples. I will show you. One example is the federal government spends about $48 billion in NIH, right? So where is that research going? Who has access to it? So when I was at NCI, we created with a group of people, other agencies, something called Cancer Control Planet, essentially synthesizing evidence on cancer control and making it easily accessible to stakeholders who are doing cancer control programs, the tobacco or screening. So we adopted it and we call it Planet Mass Connect in Massachusetts. And with the help of our community partners, implemented it so that community-based organizations in Massachusetts have access to evidence-based interventions. This is a way of interpreting evidence and making it easily accessible to CBOs or NGOs in Massachusetts, right? So this and everything here has been designed with our partners, right? None of it is done by ourselves, right? And when they asked us during COVID to pivot from cancer to COVID, we did that, because that's what they wanted, right? So that's being receptive to their, and to their needs. We also did that with increasing supply of information. We were training journalists. We trained 200 journalists in India on how to communicate science and health. And it was on nutrition and malnutrition and women's health. We also had to pivot during COVID to make sure that they have access to synthesized research evidence on COVID, right? So this can be done, but it has to be participatory in many ways, right? With working with them. So let me conclude here. So just to say information itself is not communication. There is this problem of mis and disinformation. And information voids play a big role. That's why I keep saying supply and distribution is important. Sources of information are multifold, intentionally or unintentionally. It's just not one group. And inequalities matter. This is the heart of everything I do. Today it's verboten. Apparently it cannot be funded. A number of my grants have been terminated or under termination, threat of termination, because of equity related issues. And we have to think about systems approach, not just the individual approach. I know I went very fast, but I wanted to leave at least a few minutes for conversations and questions. So thank you so much.
So much, Vish. True scholar, 3-act session on how to build trust in science. And two things really struck me about the talk. One is the term social determinant. We have heard that ad nauseam for so long. And you're right, it's in some ways fatalistic because it's determining that these are set mutable factors that could determine their health, when in fact they are. And when in fact there should be drivers and not determinants. And that is a very uplifting, proactive way of seeing health outcomes, in particular vaccine trust in science and data. And I was really struck by your 4-part intervention that we could do to change trust in science, whether it's about supply, demand, distribution, or uptake. And I want to leave with that very uplifting model that you put up, opening up to questions from the audience, as well as the over 100 people who are on Zoom right now joining us on this talk. Questions from the audience? Yes, can you please say your name?
Sure, I'm Tim Cunningham. I'm an entrepreneur. Disinformation that's driven by self-interest, can't that be criminal?
So maybe I should be, yes, sure. So Mr. Cunningham asked whether disinformation can be criminal. We spent a lot of time on this issue. And certainly, I'm not a lawyer. Actually, I come from a family of lawyers, but I'm not one. So, I've been thinking about this. It's very difficult because in our country, at least, we have this First Amendment and freedom of expression and free speech, though that's being challenged every day now. And I'm we're facing it in our institution at least. And so that precludes actions, where you are placing restrictions on free speech. There are examples. I think the European Union has been looking at it, much more closely. As Justice Learned Hand, I think, who said this, you can't cry fire in a crowded theater. But what does that mean in terms of interpretation in these days? We felt that there are, and I'm going to use the word collectively, I think, because of the committee, I think there are potential opportunities to intervene through existing acts. And there are efforts, as you know, in the Senate, particularly coming out of Senate, on some of these potential ways to regulate platforms. And we'll have to see what happens. Number one, we don't know what the acts will actually look like, including Section 230, et cetera. And then whether that will stand the test in the courts. Certainly, I think, the damage is there, but whether that damage is, the challenge here is, this is an interesting problem. If you look at the design of the studies, you cannot make causal inferences very easily, right? Unless you are doing this in an experimental context, right? I hope I'm making sense here, right? And experiments are fine to do that, but if you look at a larger ecosystem, our designs are not equipped to make that kind of a causal inference, and attributing this to a message having an impact on somebody and leading to harm. That makes it a challenge to say there is evidence for that, right?
Question from the director. Thank you so much for just an incredible and timely talk. I'm going to ask the question that is potentially not as articulately put as your beautiful. Part of the problem seems to be that our beliefs are no longer a la carte. They are all fixed menu. If you're a Republican, you should be believing in these things. If you're Democratic, you should be believing in these things. And now, unfortunately, public health interventions and vaccines have started getting divided. It seems like, although evidence still shows the majority of Republican parents actually still support vaccination. And it's not just the politicians who seem to be pressing this point, trying to use political identity as a way of generating followership in a particular political belief. We do it, it's not us do. We say, right, Republicans believe this, Democrats, which is what the data shows, but at the same time, it then reinforces this political identity and its attachment to health. How do we disconnect the two and work on people with
So the question is, how do we depoliticize? I'm going to summarize or paraphrase it. How do we depoliticize these contentions and claims, some database that opinions and beliefs are identified by party, which is somewhat empirically questionable. Is that accurate? Yeah. So that's why we call it, as you know, belief systems, not just beliefs. Ideology is more a system of, concatenating thoughts and ideas and idea elements put together to make some kind of a coherent sense of the world, and certainly the question then comes up: is this belief system mutable or immutable? I think, and so that's one important point worth thinking about. We have seen it is very much mutable. It's not fixed. As you know, I'll take the example of COVID, which is, you have been all over TV and other places, the federal government advising them. As you know, despite initial skepticism, most people got vaccinated, right? Republican, Democrat, Independent, That's because there was this somewhat uniform message. There were elements of dissent, but somewhat uniform message out there saying that, COVID vaccination saves lives, or at least reduces the harm of impact of COVID. So these belief systems are certainly mutable. I think what becomes difficult is when increasing polarization challenges that consensus-based approach, I think, right? So if it is a small group of people, whatever the party ideology, we can do the same thing with Democrats too, right? On certain issues. And it's okay, I think, it's manageable. I think what becomes difficult, as you know, is when there is this overwhelming consensus within a group, whether it's a political party or whatever it is, and that group has legitimacy, quote unquote, and the entire information environment is suffused, then it creates challenges and problems, I think. Then it's a little difficult to challenge that belief system. But it's mutable, right? It's changeable. That's one thing I wanted to say. The second point is important, I think, which you said, and I'm thinking about it too, because this is what I did during when I made the presentation for the National Vaccine Advisory Committee on vaccine confidence. I said, everybody is getting vaccinated. It's only 7% or so who are against vaccines. And therefore, there is a tremendous amount of confidence out there. We are doing the right thing. Parents are doing the right thing. Let's support them, right? But here, now in the data I showed you, in the data in the slide, it's something like 72% of the Republicans compared to 90% or something like that. So we can still say only 30% are opposed or so, right? It's a question of framing, how you frame these things. And also, I think, we haven't, I think, figured out how do we break that dominant consensus frame within a particular group, I think, So I thought we have been very successful until 2-3 years ago, if you looked at coverage about vaccination, immunization, no journalist took that seriously, the anti-vaccine information, right? There was this overwhelming consensus. There's no debate on that. But you cannot avoid it when the secretary or the director of the commissioner of a particular agency says one thing, right? Even if you say I'm skeptical, but so and so said it, right? That's enough for that to get some airing, I think. So that's providing a challenge to us, and that's why I was saying earlier, we need to think through collectively what to do. I'll say one more statement. I know we are getting close and maybe other questions. I'll say one more statement. What is worrying me? I'll tell you what is worrying me, keeping me up in the night, among many things these days. If each state starts going their own way against the consensus, right? So now AAP is going to make recommendations against CDC almost, I think that's what will happen. Massachusetts is forming a collective. Maybe New Hampshire won't sign up, but others will, right? Now you will start seeing significant immunization and vaccination differences across states, right? That will be terrible. I mean, that will be the worst, absolutely nightmare scenario, I think, in the country. It took us 30, 40, 50 years to build that consensus. And today, if you're going to see it this way, where certain states will have, you're already seeing that actually, right? Florida is a great example. I mean, absolutely scandalous. I think that's what worries me. And then that kind of a belief system becomes much more reinforced, I think, I'm sorry, it's a very rambling response to your questions.
I don't want to ignore the
Yes.
Are there any Zoom questions
Yeah.
as well? Not right now. Okay, so let's take that. Let's practice. Yes. Thanks a lot, please. Hello.
Can you speak up? You don't mind.
Hello, my name is Nicholas Roy. And I just personally really love how you started off with information as not communication. And I think this is very storytelling puts in. And it's maybe a very simple question, but I want to have Because I did notice in the slide, you said, if, that family was an important factor when, sending on information. If family is an important factor in sending on information or misinformation, would it be smart to target, the tech savvy in the family group, or like like you mentioned, the husbands, the male, about to spread, valid information? And should we be designing, messaging strategies targeting those specific groups?
So the question is focused on who do we target, if I can say that, who do we target in our strategic communication campaigns to ensure that it is circulated appropriately, whether it's families or in other parts of the community. A couple of thoughts about it. Number one, and you raised a number of things which I wanted to address, but I don't know whether we'll have time. Obviously, yes, I think, I think you all have done more work than I did. But in terms of communication, right, we do focus on what we used to call as opinion leaders, or people who actually are followed by other people because they have credibility and in the family, they have access to information, or they have power in social power, so to speak. And certainly there are a lot of campaigns out there, strategic communication campaigns, which have used different strategies to reach out to these stakeholders. In fact, every time we do strategic communication campaigns, we spend a lot of time understanding where people get information, who are the principal players they rely on, and then we target those players, whether it is whoever it is, right? Depending on the country, context, culture, and community, we do that. So certainly, I think families is one way to do that. Faith-based organizations, another way to do that, or community-based organizations. It depends on the campaign, topic, community, culture, etc. So to do something like that. So sorry, it's a very vague response, but okay.
Tom, I think we're just about, we are very grateful for your
Thank you.
thoughtful
Sure.
conversation here and just making time for us.
Of course.
Very busy schedule.
Well, thank you. Well,